We have a special guest with us today. We have Dr. Teresa Baker. So breast milk can make a difference in a baby's health, especially for infants born prematurely. And here in the community, families have access to important resources and support. That's why we have Dr. Baker in today from the InfantRisk Center at TTUHSC to kind of talk about the benefits and some of the helpful resources that y'all have. So Dr. Baker, thank you for coming in today. We appreciate it. So why is breast milk so important?
So it's not just milk, and that's what we are learning more and more about all the time, is it's enzymes, it's antibodies, there's lots of growth factors in breast milk. So it's more it's much more than just nutritional for a baby. It's immune system, it's cognitive development. We've shown over and over that exposure to the breast milk can really improve outcomes and is so meaningful that both hospitals actually have access to donor breast milk for those moms that can't produce their own milk or need help in the beginning to get the babies off to the right foot.
And tell us a little bit more about the milk bank. How does all that work?
So let's say that you have a child in the NICU. Breast milk may be the thing that actually is more important than any medicine we can give them. It can protect them from necrotizing enterocolitis. It can help their little brains develop. So what the NICUs do is they give moms the ability to pump their breast milk and feed the baby, but if they cannot, then they have access to donor breast milk. The donor breast milk comes from, both hospitals currently use the Mother's Milk Bank of North Texas. And when you give to a milk bank, you go through a screening process very similar to when you give blood. So you go through a questionnaire and they take blood samples. It's a very extensive evaluation the first time you give, and then they test your milk for drugs and recreational drugs, and then if you qualify, then you can donate. When they pool those samples, then they pasteurize them, and then they send them to hospitals, or you can purchase the breast milk. Like, let's say you can partially nurse your baby, but the baby needs more and you'd like to supplement with breast milk, then you can purchase breast milk from the donor milk banks.
Wow. Okay. It's just kind of new to me. I'm not a mother yet. I would love to be one in the future, but that's so interesting. And why? So can we go back to, like, breastfeeding? Why do some mothers produce milk on their own, and why can't some?
That is such an important question, and one we don't have a lot of answers for, and it is one of the most tragic parts of new motherhood, because people really feel like they're failing their baby if they can't nurse their baby. And this is just a way that they can get that baby the benefit of breast milk. We don't have a lot to offer for moms. We don't truly well understand why some moms are really good producers and some moms are not very good producers, but this is a good option for those mothers to be able to get the benefit of it. And you see some of the most magnanimous parts of people. Like, I had a patient recently that was diagnosed with breast cancer and needed to undergo treatment right away. Well, her friend donated 6 months of breast milk to her that had been stored, and what a gift. I mean, you just can't even put a dollar figure on that. So you see a lot of wonderful parts of people in this journey as well.
Yeah, and where can we go for more information? Also, where can we go to, like, if there's any mothers out there that want to donate?
Yeah, so Northwest Texas serves as a depot for the Mother's Milk Bank of North Texas. So there is a local place that they can give the milk to, and they pasteurize it and distribute it out of the milk bank in North Texas. But you can go to the InfantRisk Center, InfantRisk.com. We'd love to help you get signed up or help you with any resources you might need to get in touch with them.
Well, Dr. Baker, thank you for coming in.
You're welcome.
Of course, and stay with us. We have more Studio 4 on the way.